And we're honoured to have the Premier here today, the Honourable Barry O'Farrell. And could you please welcome the Premier to the stage?
Thank you, Norman, and it's a great pleasure to be here. And can I start by acknowledging the traditional owners of the land whose land this was, is and always will be, and who, of course, for tens of thousands of years managed their own health very successfully upon these shores and upon these waters until we arrived 225 years ago. And that's just another reminder why the work that you do in this city, across this state, is so important. We do need to bridge the gap in many areas, but in relation to health, there is no bigger area that we need to bridge it in than in relation to Indigenous health. I simply wanted to make a couple of reasonably quick points this morning. Firstly, innovation is important. As Gillian and Mary were saying a few moments ago, we need to constantly be trying to do things better. We need to be constantly ensuring that the services that we're seeking to provide are provided as effectively as possible. And importantly, we need to try and change people's behaviour. And in part, one of the ways in which we do the latter is by emphasising teamwork. And you who work in our great health system know that collaboration and teamwork is absolutely critical. We know, and we were committed in opposition to greater local control of our health system, because we believe that greater collaboration by those who provide the services, those who receive the services, in the managing of our health services, it can provide far better benefits for people and better outcomes for people right across this state. The government is committed to using teamwork to try and drive innovation. The government is also committed through the New South Wales Department of Health, whether through Gillian Skinner's efforts or whether through the Minister for Healthy Lifestyles, Kevin Humphries, who's here today as well, to try and ensure that people like me, particularly people like me, also understand the need for us to do our part as we seek to live healthier lifestyles. You're looking at someone who in mid-2010 weighed 25 kilos more. You look at someone who in 2510, knowing that he had a fairly big ordeal coming up in March of 2011, decided to do something about it. Decided to try and change his life habits of eating to reduce it, to change his life habits of exercise to increase it. And 25 kilos on, I have to say that not only do I feel much better, not only am I able to put more into my day without noticing the hours, but I'm also using health services across the state much less. And that has to be part of what we do. And whilst I don't want to reduce everything to dollars, because too many people in my position, too many people in ministerial positions do, if we do want to address health concerns across the state, if we do want to ensure that we have additional dollars to address to those things we can't control, like ageing and the like, one of the best ways of doing it is to modify people's behaviour, hopefully before they get to my age, and hopefully as part of a long-term change to their lives. We know that educating people in the importance of properly managing lifestyles factors is absolutely an important focus for New South Wales Health, because the WHO has found that modifiable risk factors were eliminated, that if those factors were eliminated, at least 80% of heart disease, stroke and type 2 diabetes would be prevented, as would over 40% of cancers. Modified lifestyle risk factors are also, as we know, a major contributor to the high prevalence of chronic disease in this country. And it's estimated that almost 70% of people living in rural and regional areas, compared to 50% in urban areas, are affected. And of course we know, going back to my first point, that our Indigenous communities are amongst those most affected. So the second thing I want to say today is that New South Wales Health, through the Office of Preventative Health, has partnered with the New South Wales Rugby League. You thought Rugby League finished last weekend. Well, it hasn't. They've successfully piloted last year a program, the New South Wales Knockout Health Challenge, in Aboriginal communities. The challenge was an innovative, healthy living program trying to reduce the rates and severity of chronic disease in Aboriginal communities. We know that rugby league is integral not just to the broader community, but especially in contemporary Aboriginal culture. and partnering with the NRL was a powerful way to connect with those communities. Now, the 2013 challenge included 580 participants from 22 teams drawn from right across New South Wales. Participants lost an average of 4% of their body weight. So I should have forgot about reducing less, I should have simply taken up rugby league. This program is a great example of the effective teamwork between the different sectors of our community, a collaborative effort that makes a real impact on the health outcomes of people across our state using great innovation. The challenge aims to motivate Aboriginal people to lead healthy lives to reduce obesity through collaborative, team-based weight loss competition and other physical activity challenges. It's an innovative community-led program with support from volunteer team manager, town committee and a membership from various local organisations. Volunteers have played a vital role in this initiative, as they do in so many other areas across the health system. And NRL player ambassadors provide teams with support and encouragement via a Facebook page. And I want to introduce you this morning to two of those ambassadors. Firstly, George Rose from the grand final playing Manly Sea Eagles and Reece Robinson from the Canberra Raiders.
Thanks for coming on. So, tell us why you got involved in the Knockout Challenge, Reece.
Well, you know, a lot of people look up to us. We're a bit of a role model to the Aboriginal communities out there. So I think just the sports and stuff we play, it's good to get all the younger kids and other people to get into a healthy lifestyle. So just trying to change the Aboriginal life expectancy and stuff like that. Just trying to make them healthy and look up to us.
What have you seen happening out there when you've been out there talking to the kids who are getting involved in this challenge and others?
Just like I said, you know, a lot of people look up to us. So yeah, just trying to get them involved in kind of sports, eating healthy and stuff like that. And yeah, just get them into a better life, I guess.
George, better luck next time.
Yeah, we came up a little bit short on the weekend.
But you still got there in the end in terms of the finals, which is a message for kids out there and communities in terms of this challenge, isn't it? Really, it's the doing.
Yeah, it is. You know, we defied a few odds to get to the final, and you know, I think a lot of the kids and the people within this program are defying odds by being a part of it and getting some great results.
And Premier, I mean, this sort of community-based activity, not just in Aboriginal communities, and this role model is just so important.
We need people to be modelling these great behavioural changes all across the state in all communities, not just the Aboriginal community, although you know there are particular issues there, but across the broader community, so that people like me don't wait till they're 51 to do something about their health and exercise.
What I want to do now is introduce the person who came up with the idea for the Knockout Health Challenge, who's Programme Manager of Chronic Care for Aboriginal People, Raylene Gordon, and also the Indigenous Rugby League Manager of New South Wales Rugby League Innovation Symposium. We've got a video which we'll throw to in a moment, but just tell us how all this began, because it's really your idea.
Yeah, the idea came from another program that we run called the One Deadly Step program, which is a community screening program. We screened over 200 people on the day and found that over 90% of those people were overweight or obese. So we thought we needed to respond to that, and what we did was we wanted to build a program that was not a new program but would bring people together so they could access existing services like the Get Healthy service and dietitians and facilities that were already there. So it was really about improving access and responding to some community screening.
Tell us about this video that we're going to watch.
Sorry?
Tell us about this video that we're going to watch.
Oh, so this video is from Menindee. They've won the challenge back-to-back, 2012 and this year, and it just gives a bit of it just looks at, it interviews a couple of people who are involved with the program.
Let's have a look.
It all started up there coaching the local football team, the kids, and a few parents wanted to get involved and they said, how can you help me lose some weight, you know? And I said, look, simple, you know, abs are made in the kitchen, not in the gym, but doing a bit of work also helps. So we started up a little program at the school twice a week and just exercising. That was Indigenous and non-Indigenous people exercising, and then we heard about the competition that New South Wales Health offered, and we said, yeah, let's throw a hat in the ring and we'll win this.
We always get stereotyped being Aboriginal. We got all the odds against us. We got diabetes, heart disease, cholesterol. This year alone we've lost so many of our mob through all those diseases and more.
16 months ago I lost my mum, also lost my aunt through diabetes, and I don't want to go down that road.
It's time for us to get off our butts, do the hard work and start living better lives and lifestyles.
I went on a challenge, I noticed things were getting better, and then at the end of June, I had my last blood test, it was 8, so I was just ecstatic with that.
My sugar went from being around 12 to 7. Fiona's blood pressure stuff went down. Lisa was taken off her tablets. Ollie had oxygen reading of 100 first time in her life. He had to check it twice.
So I lost a proud 7 kilos, but I also left 10 off from the last season. So.
And I lost 21.1 kilos.
Well done. So Ricky, tell us a little bit about the NRL involvement and how all that works.
With my involvement, I suppose, because I work for the New South Wales Rugby League and I'm the Indigenous Program Manager there, when I was approached by the New South Wales, Raylene and her team at New South Wales Health, we looked at maybe trying to do something which was innovative, using rugby league to promote and use it as a vehicle to advocate the messages of health and trying to improve health. And obviously it touched a heartstring with me because I come from Walgett originally, which is in a remote part of northwestern New South Wales. And obviously the Minister for Healthy Lifestyles, Kevin Humphries, come from Moree, which is not too far down the track. And just to digress for a minute, I can attest to the Premier, Mr O'Farrell's weight loss and his ventures in losing all that weight, because unofficially I knew him, and sort of officially I did get to meet him later on. But we both...
Did you recognise him after?
Pardon?
Did you recognise him after?
No, I briefly recognised him, but now I recognise him a lot more. But anyway, no, it's a bit of a... I've known him for a little while now. But we used to work at New South Wales Rugby League, used to be based at New South Wales Leagues Club in Phillip Street in town, and there was a little gym downstairs. And it served a purpose for both the Premier and myself to try and get a bit active and healthy. And I used to see the Premier in there on occasions doing his bit, and he was wired for sound, and I'm not too sure whether he was listening to the Eye of the Tiger, because that's who he supports, or whether he was listening to Andre Rio trying to forget the pain that he was going through. So that's another thing. But to get back to the point...
But 1 or 2 kilos hit the day.
Yeah, well, I never got to distinguish which one he was listening to, because I never got a lend of his earphones. But certainly he was inspirational, because he did lose a lot of weight at that time, so he obviously had a goal. And I think what we tried to do with the players, including players in the program, was to get them to provide not only the role model type of image, but also some sort of leadership. And George is a classic example of that. He's a guy that, he's not picture perfect, even though, when he looks in the mirror, but I can say that about him, because I know he used to sleep on my lounge room floor when I was playing footy for St George, so he's right. He used to come down and visit me, but I've known George's family for a long time, or from Walgett, of course. But his dad died at a young age, obviously from a chronic disease, which and George's dad was a mentor of mine as I was growing up as a young boy in Walgett, and I've carried that through. And some of those beliefs and values that George's old man passed on to me, I tried to live by those beliefs and values, and they made me the person that I am today to be able to come down and address you guys. So when we talked about getting role models, we had a look at who might fit the bill and who might not. Reece is only new to it, and I must confess he's my nephew, so that's why he's here at 7 o'clock this morning. Didn't want to get out of bed early, but I went and
What a
picked him up
nice
anyway.
uncle you have, Reece.
He's not noted for that, but these are the type of young blokes that need to, and young females, for example. We're looking at who we might get involved in that to cover the whole base for gender base, of course, because we've certainly got to look at male and female life expectancy for Indigenous people. So when we got these guys involved, obviously their basis of playing rugby league is to be fit and strong and healthy. So we knew we were on a winner there, but also the type of person that you want there is to be a good role model, not only for the kids at school but for the community in general. They play good footy on the field, but they also have to be ambassadors off the field. So that's basically what attracted us to these guys, Norman. And I just clarify one thing. The boys play for the NRL, but we want all the young boys who are playing rugby league to aspire to become NRL players, and obviously playing grand finals or whatever, which is George was unsuccessful, but he's also got a grand final ring, so you don't want to be too greedy, George. But the other thing is that these boys, their basis of their, I suppose, development came from New South Wales originally, because they're all connected in one way, shape or form to New South Wales through their hometowns or the communities that they're currently living in, or that developed and enable them to get the opportunities that they've got at the NRL level. And that's what we do at New South Wales Rugby League. So, credit to Minister Humphries, Minister Skinner and Dr Chant and Raylene and her team to still engage with us at the New South Wales Rugby League to help things come to fruition. And we're very proud and pleased to be associated with the program, and thank you all for supporting it.
George, how much are you driven by the fact that you don't want to die young like your father? The experience of your father sitting there in your head.
Yeah, well, I think it's very important. It's heart disease and diabetes is a big issue broadly across Australia as well as in Indigenous communities, and having it so close to home. A lot of my uncles and aunties also have diabetes or at risk of heart disease just because of lifestyle decisions and things like that. So it's a constant reminder to myself that I need to be wary of what I'm doing, and to have a challenge like this, this program that's come up, I think it's outstanding to get the message out across communities and to people who wouldn't usually know the right foods to eat or the right exercise to do. And it could only be an hour a day out of your time, and it's something easy that you can do.
And of course it fits with community ethos because it's teams, it's groups of people working together.
Yeah, well, we're all competitive people who love our sport, so to be able to do it as a part of a program like that where you're competing against other teams across the state and you've got everybody around you doing the same thing to support you through the whole period, I think it's really good.
Raylene, we've had a question by SMS. I think there's 22 teams, is that right? But how many people have been involved?
So communities register up to 30 people, and so that's 30 times 22 teams this year.
So I'm not going to do the maths, it would be too embarrassing.
Neither am I.
But one of the interesting things that happens here when you do something like this, they call it social contagion, like things spread. So you might have a team doing it, but the fact that the team's doing it affects the rest of the community. Have you noticed the flow-on effect to the general community?
The good thing about this program is that it's got structure in terms of it is a competition, but the good thing is that local communities make decisions about how they're going to, so what nutrition plans they're going to follow, what exercise plan they're going to have. And what happens is one of our commitments, being the program organisers, is we commit to train with every team in every community. And what that does is it gives us a real good feel for what's happening on the ground. Every community we go to, there's the team, there's the parents, there's kids, there's more kids than anything at the training session. So that flow-on effect is certainly evident in the site visits that we've had.
That was a pretty fancy gym at Menindee.
Yep, it is.
Just further to that too.
Sorry, Kevin's obviously got some comment.
Further to what Raylene's saying is that we're trying to empower communities to be their own role models, because when I was growing up I didn't have my parents around, so my grandfather was my role model. So the parents of these kids now are the role models for their own parents, and it's great to have the NRL players there as, you know, on Facebook and Skype and all that sort of stuff, giving them messages of encouragement and support and, you know, inspirations and things like that. But we want to try and, through the team managers and the teams themselves, make the parents of the kids become role models to their own children in the communities, because that interaction would only foster the home life and the school to work, school to home to school communication with teachers and all those sorts of things that Indigenous people have not been really good at, trying to address those anomalies as well.
My question actually with the gym was, are we leaving behind infrastructure? It's sometimes quite hard in country towns and rural areas to take exercise. There aren't pavements to go running or walking on, and there aren't running tracks and so on. Are we leaving behind some infrastructure here that people can do stuff?
So the winning teams are awarded small community grants, and they decide what they will put back into their community. So Menindee has part funded that gym with their community grants. So they are building local infrastructure.
There's a question up here.
Hey, Young. How you going? Damo from Taree. I was part of the Foster knockout.
What was the name of the team?
Foster. It's Taree fellas. Won't dive them all in. But we've actually extended what the knockout program from these, because it goes on the off season. So we're doing the Clean Slate program at PCYC, which is rolled out at the eastern seaboard of the mid-north coast. Nessie Stewart and a few of those boys, that a lot of you boys will know there. So we're actually engaging in the youth to actually become role models now from like 5, 6, 7, 8. And I just want to thank you guys for part of this program, because they've got a lot of young fellas engaged into us, and then we put the breakfast program into it. So they got 3 meals a week from the gym when we picked them up, 5:30 in the morning, then dropped them at school. Now their education's going on, teachers are asking us to come in. So it's had a massive flow-on effect. So it's I just want to thank you boys for that.
Thank you.
And girls.
Yeah. And girls, as Raylene is keen to emphasise.
That's an important point though, because what the challenge does, like I said before, it's not, we don't want to build a new program, we just want to link people into existing services and build that journey. So thanks for bringing that up.
And you're also using social media quite a lot. How are you using it?
So the teams talk to each other through Facebook. So all the information that we want to give to teams, it's basically communication and to
and the ambassadors do as well.
Ambassadors,
Yeah, it's been good. I've had some of the people from the Central Coast who I was involved with. They contact me on Twitter, and you know, sometimes I'll have some questions about a new training routine that they're sort of looking for, because they're getting a little bit stale or something like that, and just some tips. So it's sort of good to have that contact.
They need a coach to come and yell at them, don't they?
Sorry?
They need the coach to come and yell at them a bit.
Yeah, well, I'm happy to give the orders. I'm always getting orders at training, so I know what they're saying, and I'd love to dish out a little bit of punishment for them.
Well, what a fantastic project. Thanks for coming to talk to us about it. Thanks very much. Thanks, Reece.